Hi everyone, this is Dr. Isabelle Amigues, your friendly rheumatologist, and I'm going to go live on Instagram as well. We are a little bit early today because I have to do something with my kids and I just couldn't make it happen otherwise, so I apologize. If you are watching this live, please put a hashtag live. If you're watching this as a replay, put hashtag replay. As you know, this is how I don't know how I call that. Facebook and Instagram and all of this sees that this is interesting and they share it to other people. And it's always wonderful to know that other people that may need this are having access. And again, I'm Dr. Isabelle Amigues. If you do not know me, I'm a rheumatologist in Denver, Colorado. I'm French, and that's why you're hearing that French accent. And I'm in a direct care rheumatology practice where I work for patients and not for insurances. And so that's what we call it, a direct care rheumatology. And I love doing those lives because I can discuss things with you guys that are like questions that are coming up. And instead of having people who are not necessarily rheumatologists, that don't necessarily know the science, I can actually debunk some things, give hope, because that's really what it is about, like giving you hope. Without further ado, let me tell you why I chose the topic of today, which is, should I stop using my joint if I have arthritis? And that's such a really important question. I recently had a patient who presented with osteoarthritis, which is wear and tear. So it's really not the inflammatory arthritis, but rather the overuse arthritis. In fact, I have a little bit of osteoarthritis because I'm a rock climber. And at the beginning of rock climbing, I didn't really use properly my joints. And that's okay. It's not a big deal. It's not necessarily pretty, but other than that, it's not a big deal at all. And basically, the question that she had was like, well, hold on, like, how do I make sure that this does not progress further? Should I stop using my joint? And the issue when you're starting to look at this is that you're like, every time you're moving your joint, you're like, wait, should I stop doing this? Should I stop doing that? Should I stop doing this? And then you're not having a full life if you do this. So I wanted to debunk a little bit some of those things so we can talk a little bit more into what's going on. So as you know, if you have followed those lives, and we've talked about osteoarthritis in the past, I'm going to tell you, go on the Rheumatology 101 by Dr. Isabelle Amigues, Amigues, on YouTube. They all live under the live section, and look for the osteoarthritis if you haven't seen that yet, okay? But so when you have osteoarthritis, we know that your body is more prone to develop osteoarthritis because you have it. So you may have another one, right? And so then the question that comes is, how do you make sure that it doesn't progress further? So maybe it's because it's painful, maybe it's because you think it's ugly. No matter what the reason is, we want to protect our joints, right? And then the other thing is that if you have an inflammatory arthritis that you don't take care of, the issue is that the endpoint will always be osteoarthritis, because osteoarthritis is a loss of the cartilage and then it goes bone on bone. We do not want that. The thing, though, is that when we're thinking osteoarthritis, there are things that can really cause issues. And so it is repetitive movement. But it is not necessarily when you stop using them that's a problem. So what I mean by that is this. If, let's say, you have osteoarthritis of your knees, and you're constantly going up and down the stairs, but the way you go up and down the stairs is when you're not actually using your muscle. And so every time you're going down the stairs, you're pushing on the knees, right? Because you're just going down, pam, 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 going down the knees. That is problematic for your knees. If you continuously jump on your knees without doing proper use of your muscle and tendon and ligament, that is when you're doing something wrong for your joints. And so if I had to say, like, if the question is, should I stop using my joint if I have osteoarthritis to prevent worsening of my arthritis, I'm going to say no, but, all right? Or I could say yes, but, right? Same. The but is really important. In general, I mean, I can say yes and, or, no and. It's the and or the but that's very important, because You do not want to stop using your muscle, ligament, and tendon. You want your muscle, ligament, and tendon to be very strong because you want them to take over for the joint. You don't want the cartilage to take out of it. You want your muscle to help. So for example, if you're jumping down, you don't want your joint, like just the cartilage, to absorb the jump. You want the muscle to absorb the joint. So what does that mean by that? Look at kids, how they are jumping. They are using their muscle. Okay, they're not using their joint, they're using their muscle. They're very like mobile, and they really use all of the muscle of their bodies. And it's the same thing if you're going to do repetitive movement, so rock climbing, and you're using your hands. You want to do proper hand training. So I was showing this to my patient. I was telling her, look, there's no muscle in the fingers. I'm going to say this again. There is no muscle in the fingers. The muscles are in your palm and in your forearm. And so what it is that if you're doing constantly movement of your finger, like if you're on the keyboard, you want to learn how to use your forearm and how to muscle your forearm. That's what you really want to learn. You want to work. And so if you have osteoarthritis, I would recommend to start looking at videos of how to strengthen the muscle around your knees, how to strengthen the muscle of your arms if you're a rock climber, and so on. Because what you're trying to do is that you're trying to get the muscle and the tendon and the ligament to get stronger and use and help the joint, like help the cartilage. And it's the same thing with the back. You may have osteoarthritis of your back. I probably do. A lot of us have. It starts very early. But the pain comes when it's bone on bone, when you are basically not using your muscle. And so one of the recommendation is to actually do abs and planks so that you muscle your back. You can rock climb too, right? That's a very good exercise for your back muscle. And really what you're trying to do is to really put the joint as part of your whole body. And in your whole body, you have the muscle, you have the tendons, you have the ligament, and that is what you want to use. So if someone tells you stop using your joint, I want to say that is wrong, because if you stop using your joint, then you stop using your muscle. And then what it ends up happening is that the only thing you're using is actually the cartilage. And you're asking your cartilage to do everything, and that is not what we want. We want you to, on the other, like almost opposite, is we want you to start working with your muscle, your ligament and tendon, but you want to do it properly. And so when you're going to walk down a stairs, I want you to start thinking, how do I engage my muscle? It's actually much harder than you would think, because we're so used to not properly walk down the stairs, right? How do I engage my muscle? Use the rail if you need to, okay? Same thing with your hands. How do I make sure that I'm engaging my muscle? And right, like what's going on here? And you can see that your muscle are coming, like there's the tendon, the muscle of your fingers are, there's a lot in the palm, but there's also a lot more in the forearm, and you want to use that. And as a rock climber, that's what you want to use. You don't want to use your fingers, because that's going to be joint, and that's going to be cartilage and ligament and tendon, instead of using the muscle that are so much stronger. Okay. So that's some things, like I think that, there's no black and white answer in general, but you have to put it in the context of what's going on. If you have ongoing inflammation, please don't use your joint just yet. Like, don't go and run a marathon. If you have osteoarthritis, I think you can run a marathon, but the question is, like, can you make sure that you're doing it properly? And work with a coach, work with someone that's gonna teach you how to do the strokes, how to really prevent damage of your joint. And what I have seen as a professional, right, as a rheumatologist, is that people who actually go and do sports and exercise, but do it properly and work with coaches, physical therapists, and so on, they actually know and they learn how to properly use their muscle. So they strengthen their muscle, and by strengthening their muscle, they actually prevent further damage, and there's less pain. Okay, one little thing that I'm going to add that's really cool is that there is just a study that just came out on GLP-1 agonist for knee, I think it's hip osteoarthritis, hip or knee, can't remember. I'm so sorry. I'm sure it's gonna show in both actually later on. What they found is that not only the patients are losing weight, which we knew that because that's what the GLP-1 agonists are made for, right? Like the semaglutide, the Wegovy, the out of those like Wegovy. Semaglutide, there's another one that's a GLP-1, but out of those drugs, right, to lose weight. And I was telling you a long time ago that I think that they have an anti-inflammatory component. Like they are anti-inflammatory. I'm pretty sure we're going to show this very soon. But this study is really cool because not only they found that people are losing weight, which is great, but they also had less pain and more function of their, it might be hip. I'm so sorry. I look at that and we can even talk about this, but the hip joint. And I think that's another argument to say exercise. And if you have some overweight, please don't stay stuck here. We have very good treatments now. And I think that that's really powerful and wonderful to do this. Okay. All right. Thank you so much for listening all the way to the end. There's so much more coming into the world of rheumatology and even in osteoarthritis. I honestly feel like in the next 10 years, we're going to have incredible treatment. Don't stop moving, but rather continue to move and work on really thinking how you move properly. And if you've watched this all the way to the end, please share this with one person that would enjoy this and would learn from it. Once again, I'm Dr. Isabelle Amigues from Unabridged MD, and I'm a rheumatologist in Denver, Colorado area, but we also see patients on telehealth. And I'm just going to say hi, even though this is not my usual time. Rock Doc, hi, how are you doing? And you said, bonjour, when I had treatment for osteoarthritis in my wrist, cartilage missing between lunate and capitate bone, I was told to use them as much as possible and to take supplements. And the supplements must be turmeric. Some people say chondroitin works. The studies are not great. Honestly, it doesn't hurt, so why not? But yeah, absolutely, use them as much as possible. But I think using them in a way that doesn't hurt them. And so that's why I would say work with someone that can help you figure out what potentially hurts them. And for some reason, I've lost Instagram, so it's okay. There's probably some people here that are watching this. I'm so sorry. Google them in and chondroitin. Okay. Yeah, that's right. But yeah, so for whoever is on Instagram, oh goodness, I just have too many things open at the same time. That's the issue right there. So Human Power PLLC, hi. Awesome Mavi, hi. Love and Science Fertility, hi. And then, yeah, usually this is not my time on doing lives, but today it is. And I will see you next week at 11 Mountain Time. And until then, have a wonderful day. And I hope you are doing really well. And I'm going to just leave you with this. Rock Dog, thank you for telling us that the chondroitin and the glucosamine has worked super well for you. And I'm going to leave you on this. If something works for you and doesn't cause harm, do it, because everyone is very individual and we're all very different. And so that's, again, what I was saying. You can try. If it works for you, it's yours. And it doesn't matter what the studies are showing. We do not care. Okay. And we care that they are working for you. So I love it. Have a wonderful day, a wonderful week. I'll see you next week. Bye-bye, everyone.